Welcome back. For this tutorial video, we're going to break down the structures associated with the thorax by looking at a CT-based data set. So how we're going to do that, we're going to go basically from the superior aspect of the thorax, work our way inferior. We're going to target specific structures, specific pieces of anatomy. And this particular data set is one that utilizes contrast. So it's a CT chest with contrast, so you'll be able to see those veins, arteries a little bit easier, being that we have contrast here than we would without a contrast-based study. So let's get started. So just to kind of look at our different scans, here where you can see kind of my mouse is going over right now, we have one that's on the mediastinal window, and then we have another that's on the pulmonary window or the lung-based window over here. And then we also can see the other basic images here, so the coronal data sets or coronal images, and then also the sagittal images. So kind of as we go through, do note where we're at kind of in regards to these coronal images and these sagittal images. So I've kind of focused on the structures related to the aorta, so you can be able to see some of those veins, but that should allow us to be able to kind of go down and you to have kind of that baseline framework for where we're actually at. So to get started with the data set itself, I want to look at some of the bony structures first, and then we'll get into more of the vascular-based structures kind of going forward. So looking here, what you can see, you should see some structures that are familiar to you. So overall, yes, we've already talked about the spine-based structures, so you can see the spine here respectively. You can see the head of the humerus, and then you can see how that's interacting at that glenoid cavity here, articulating with the scapula. And then subsequently on the anterior side of the data set, you can see the clavicles. So kind of as we go down, you can watch the clavicles, and you can see how the clavicles are going to articulate with the sternum. You can see those that articulation point here at those SC joints, sternoclavicular joints. And subsequently then you can start to see, all right, some of those articulations then on the anterior aspect, with the ribs. So you can see, hey, here's the sternum. We're following the sternum down. You can see those articulation points with the costic cartilage associated with those ribs on the anterior side there. So other structures though, just to kind of follow down, just to kind of know some of these structures, we're going basically inferior to superior. So right here is the inferior angle of the scapula. You can see on both sides, the patient's pretty well positioned, being that there's a lot of symmetry on both sides. But as we kind of work ourselves up, you can see, all right, now we're expanding, we're going through more of the body of the scapula here on the posterior aspects. And you can kind of see what that scapula is actually looking like slice by slice here. So pretty cool, and you can see those articulations again at basically the SH joint, the scapulohumeral joint there, those articulations. So additionally, you can see those connections with the ribs, so you know we're in the thorax because you can see those connections there. So this is the thoracic spine. You can see those articulation points that we've kind of mentioned and talked about before. So to really start to talk about some of the other structures, let's look at the airway. I want you to again see that transition in the airway and start to say, all right, I really get the how the trachea looks like. I'm going to understand, you know, those points of bifurcation and what that looks like there respectively. So we're at the superior aspect, working a little bit more inferior. You can see kind of that C shape of the trachea with those the cartilage-based rings on the front and not on the back. So subsequently, we have the esophagus here posterior to that. So kind of just continuing to go down, you can see how that's transitioning. You can definitely see the esophagus. This is a really pretty nice data set to be able to see the esophagus on. And you can still see, let's just follow the trachea down, 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 down. And you can see that point of bifurcation right there. So this would be the definition of the point at the carina. So you can see that's true break into those mainstem bronchi there. So it's respectively the right mainstem bronchus versus the left mainstem bronchus. And you can continue out. You can actually see that bifurcation here on the left side as it's dividing out. Then into, you know, the secondary bronchi respectively there and here. So maybe a little bit easier though when we're looking at airway based structures to look over here on this data set. So let's just kind of focus on this one now, work ourselves down, and you can see definitely, all right, where is that bifurcation point out at the carina? Right there it is. It's nice and clear, so you can see those mainstem bronchi then, these dividing points. You can see again a little bit of air in the esophagus here, so that's what we're seeing back here posterior. And you can see how it's going out. It's dividing there respectively. And you can see those additional divisions then that are going to take place as it feeds essentially each of the individual lobes. So really, I think a pretty good data set to look at some of those basic anatomical structures there as we see kind of those bifurcation points, those divisions. So another point of emphasis of this basic tutorial is just to look at the vascular based structures. So I'm going to look at essentially one or two structures at a time. So one of those structures that I want to start off with, we're going to go with some structures that you know here. So looking at this basic slice, you can see basically 5 structures here. So 1, 2, 3, 4, and 5. So these structures here are referred to as the veins. So these are the brachiocephalic veins, respectively named based on their side. So here's the right brachiocephalic vein and the left brachiocephalic vein. Subsequently, then we can see our arteries. So here is basically those 3 main arteries that are coming off of the aortic arch. We're superior to the aortic arch, so we're actually seeing them as they are here. So this would be the brachiocephalic artery, left common carotid, and left subclavian artery here as well. So the 3 arteries. So I want you to see basically as we go down how these 2 veins then combined to form our superior vena cava. So you can see that that combination point. Those brachiocephalic veins are coming down and forming that superior vena cava. So as we kind of continue to work ourselves down, focus on that superior vena cava, and you should be able to see the point where that is then going to enter into the right atrium. Continuing to follow it down, you can still see kind of where we're at here respectively. So we're still superior to kind of those main chambers of the heart. So focusing down, 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 down. And now you can see that structure, that atrial-based structure here. So this would be an example of where the right atrium is, respectively. And you can see the left atrium kind of hanging out over here. Again, it looks a little bit different than what we tend to expect. The true right-left sides are a little bit skewed when we're looking at the heart, just based on its given and respective orientation within the body. So other structures, let me just go back to the superior aspect here, so we can follow some of these other structures down aside from the superior vena cava. So when we look at these structures here, our arteries, we're going to follow those down. You still should be able to see them pretty clear, and you can start to see the structure of the aortic arch then forming as we go more inferior into the body. So there's basically the true aortic arch, and you can see respectively kind of where we're at on this data set here as well. But looking at that, you can see now, all right, so that was the aortic arch, but now you can see how they're separated as we go more inferior. So what you're looking at is here is the ascending aorta coming off of the heart itself, and then you can see here is the descending aorta. So you remember those points of articulation, those points of connection. So the aorta, or ascending aorta, is going to feed off of the left ventricle. Okay, so we're going to be able to follow that down then, respectively, all the way to the left ventricle. So see how that looks? The ascending aorta, it's kind of embedded right in the center of the heart as we kind of move inferior. So you can see where that's located. So you kind of have the chambers kind of feeding around that ascending aorta there, respectively. So really a true central structure. And then you can kind of see how it's dividing. So it's the contrast is kind of bleeding in to this section here. So what we have here then would be the left ventricle. As we kind of go more inferior, you can see that interventricular septum that we've mentioned before. So you can say, all right, here is the left ventricle versus here is the right ventricle. So we can see those structures then pretty clear there respectively. So I think, like I said before in kind of the tutorial videos, looking at a static image doesn't give us that true understanding of the sectional anatomy unless we look at it kind of live in this regard. So you can see those points of connection there respectively. Other structures, yes, we can follow the descending aorta. So I'll go back to that point, that aortic arch, follow that descending aorta down. And you can see it's somewhat midline, but it's not a true midline structure in that it's not even with the sternum and even with the spinal cord, but it's left of those regions. So we can be able to see, that structure as it kind of goes down. And we'll be able to even see as it kind of goes and trails into the abdominal region, becoming what we classically refer to it as the abdominal aorta as it moves down. So you can kind of see what that structure then subsequently looks like. So other heart-based structures, before we truly move on, I'm going to give you a nice picture of the 4 cavities here. As nice as I can get for this data set. So this slice, none of these slices are like, oh wow, this is so awesome for here, but this one's not bad here. So we have, in the center, we have the ascending aorta, we have the descending aorta back here, but we can see the cavities, relatively well here at the point of the right atrium, the left atrium, the right ventricle, and here is the left ventricle here respectively. So pretty nice image here of those structures. Other structures to kind of point out, I want to show kind of the region of the hilum. The hilum's a little bit messy because the pulmonary structures, the pulmonary veins, arteries are kind of going through. But just in general, I would consider this to be the region of the hilum, and you can kind of see, where that region is here, respectively, on this, on the pulmonary window, maybe a little bit better. So note the hilum, though. Make sure you know that for labeling, for your quizzes, etc. Other ideas is the pulmonary arteries. So I refer to this, like I said, as the mustache area. You can kind of see that mustache right there and right here, respectively. So just classically referred to as the pulmonary trunk here, and then we can see our right pulmonary artery and our left pulmonary artery there, respectively. So make sure you can be able to label those, differentiate between those structures there as well. And you can, yes, subsequently see how they're entering the lungs. You can see the points of where they're going in, what would be referred to as classically the hilum region. Other structures of emphasis. We talked about a few other veins here. So the azygous vein. So we can actually kind of see that quite well here. So you can see the azygous region. As we go down, 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 you can kind of see where that's at. We also talked about the crus of the diaphragm. So as I continue to kind of go down, the diaphragm's a little bit harder to see, but as you can see, here we go. We're somewhat at the region of the diaphragm. The crus are actually very easy to see. So you can see those structures or those connections here. So this is the diaphragm here, and you can see a little bit of the posterior lung here as well, but definitely can see the crus really, really well, actually, on both sides, contralateral, so right crus, in left crus. You can see those connections there. So pretty cool visualization of kind of those connections of the posterior region of the diaphragm there, respectively. So in a nutshell, those are the structures that are associated with the heart itself. So you can kind of see, where those structures are located. I do want to kind of go through from anterior to posterior, just so you can kind of get some of these visualizations. Let me just stay, I guess, right here when we're looking at the some structures there, so you can kind of get a sense of where we're looking at. So essentially, we're on the anterior side. Pretty cool image, I guess. You can see those ribs there connecting to the sternum, that costa cartilage, those connections. As we continue to go more posterior, then you can see we're going posterior a little bit to the sternum. You can actually see the relative position of the sternum now. Here, and then you can see this subsequent position of the heart. As we continue to kind of go more posterior, of course, eventually we'll hit the spine, but you can see, it becomes a little bit messy, but you can see the region of the hilum there. You can see the region of the carina there, which is pretty cool to be able to see. So actually, when you start to look at that, you can see here's the trachea, here's the point of the carina. And here, then, you can start to see some of those bifurcation points. So here would be the main stem bronchus, but then you can start to quickly see those secondary bronchi there as well. And subsequently, you can see it, kind of on, the contralateral side, the left side there as well. So kind of an interesting data set. And then correspondingly, I do want to go through the sagittal-based images as well. So just kind of see from left to right what this is actually looking like. So go all the way to the outside here, and then work our way back in. So you can see the lungs, you can see the development of that. So here would be the anterior side, here would be the posterior side, as noted by kind of those spinous-based areas and regions. Kind of see where we're at. We're getting closer to mid-sagittal. We are at mid-sagittal plane now. Now you can tell we're working towards the left side because of the presence of the aorta here. You can see that true aortic arch there. And as we continue to go through, eventually, of course, we're going to lose the heart kind of as we go through. So in a nutshell, those are the primary structures that I want you to know for your quiz. These are going to be the primary structures that are going to be labeled as well. So if you have any questions, be sure to let me know, but hopefully you have found this tutorial video to be helpful. Thanks a lot.